Hi, I'm Katie Burke and welcome to Chalk It Up. Let's talk about customer service, or in your industry, what we can call it is patient experience. Let's face it, you are a service-oriented industry. You are delivering healthcare services, but what patients are really coming to expect is an overall positive experience from start to finish. When practices come to us and say that they want to improve patient experience, we have to go over 4 different areas. 1 is people, 2 is process, 3 is technology, and 4 is training. So let's start with your people. Your people is your whole team, from your appointment staff, to your nurses, to your insurance department, to your billing department. It's everyone. So you have to look at, do you have the right people on your team? Are they performing the right job? And are they also not just performing the tasks at hand, but are they also doing it in a customer service oriented way? How are they communicating with your patients? For example, a really great statistic is, did you know that people comprehend communication only 7% through the actual words that we're speaking? 38% is through the tone that they're saying these words in, and 55% is based on body language. This requires training for people to be so self-aware of how they're communicating to patients. Now when it comes to process, you really have to take a look at your overall flow of how the patient is taken through your practice from start to finish. And take a critical eye on it. Don't look at process-based internally. Let's look at process based on how your patient is experiencing that process. So, for example, are you having your appointment staff talk about insurance benefits or their out-of-network insurance policy while they're making the appointment? Why not maybe look at a new process and have someone that's an insurance liaison, so after the appointment is made, they talk to the patient and actually look into the patient's insurance for them. Now that is a really great experience for the patient, that you've taken that burden off of them, but you've had to make some slight adjustments in your process. The third piece is technology. There's so much technology out there that can help implement your processes in a seamless way. And what you really should do is actually start with the technology that you currently have. Look at your EMR system, see if there's things that you might not be utilizing. For example, a click of a button may be able to alert your nursing staff that the patient is done filling out their paperwork and ready to go into the treatment room. That makes things seamless for you, and it reduces the wait time for the patient. The fourth piece is training. Training is essential in executing your new patient experience program. You can't hold your staff accountable if they haven't been properly trained. Do you have scripting guidelines that you want them to follow? Have they been documented? Are they trained on the new processes? Or are there different processes for each physician that they need to be trained on and also documented? Do they understand the technology? Also, training is an ongoing process. It can't just be done and then said, okay, this is good. You have to do it on a regular basis, and you have to always look and assess your patient experience program to see where you can make an improvement. So patient experience, it's definitely a big project to take on, but it is one that is absolutely worth it and one that will make your practice stand out from the rest.